Hi, this is my medication administration skills demonstration video. I have my MAR and I am in the med room doing my first check while I am pulling the medication. So the first thing I'm going to check for is the patient. I am looking at her name. I have Marge Simpson, and I am looking at the date of birth. I can see that she has a penicillin and sulfa allergy. And the first medication that I'm going to be pulling is acetaminophen. It is 3:00 p.m. and I can see that she is supposed to get this medication daily and she has not received it yet. And so I'm going to pull the acetaminophen and make sure that I have the right drug. It matches the barcode of what I have on the MAR. And then I'm going to check the dose. So she needs to receive a 325 milligram dose, and this tablet of acetaminophen, one tablet is 325 milligrams, so she only needs one. She's going to take this by mouth, so I'm going to go ahead and set this to the side. So again, I'm looking to see that I have Marge Simpson. She has penicillin and sulfa allergies, and she is going to also take insulin and pH. And it is 3:00 p.m. and she is supposed to get this daily, and I can see that she has not got it yet. So I'm going to pull the drug and I'm going to compare the barcode to the MAR and make sure that I have the right drug, insulin and pH. And then I'm going to check the dose. She is going to receive 20 units subcutaneously. And I'm going to make sure that I have the appropriate equipment to administer this drug. Again, I am looking to see that I have Marge Simpson on my MAR. She has penicillin and sulfa allergies. It is 3:00 p.m. and she is to get this next drug every 4 hours when she is nauseous. And I can see the last time she got this drug was at 9 a.m. So it has been 6 hours since she got it. So she can have another injection of this drug. So I am checking that the barcode matches my MAR and I have the right drug of ondansetron. She is to get a 4 milligram dose intramuscularly. So I can see that this ondansetron has 2 milligrams per milliliter. So Mrs. Simpson will receive 2 milliliters intramuscularly. So I will make sure that I have the correct equipment for that as well. Sorry. And so that was my first check while I am pulling the meds. Now I'm going to do my second check while prepping the medication. So I am first going to look at my MAR again and see that I have Marge Simpson. She has penicillin and sulfa allergies. And the first med that I'm going to prepare is acetaminophen. So I am comparing the barcode and the MAR and I have the right drug. She is to take a 325 milligram dose. One tablet is 325 milligrams, so she will only need one. And she is going to take this by mouth. She is to take it daily, and she has not had it today, so she will get it. It is 3 p.m. And I'm just going to put this in the med cup for her and set it to the side. So now I'm going to, again, make sure I have Marge Simpson on my MAR. She has allergies to penicillin and sulfa. It is 3:00 and she has not received her insulin yet. So I will look at what I have on what the name says on the barcode and the MAR. And I do have the right drug, insulin and pH. She is to receive 20 units subcutaneously. So I'm going to make sure that I perform hand hygiene and that I put some gloves on. So at this step, I would put on gloves and then I would take the cap off and make sure that I put it on a clean surface. Then I would use an alcohol wipe to clean the top of the vial for 15 seconds and let that dry. So while that is drying, I am going to open up my 50 unit insulin syringe and making sure that I have the right one for a subcutaneous injection. And she is to get 20 units of this. I'll put this down. So I'm going to drop some air and stick this into the vial. And then I am going to pull up 20 units. Of insulin. There we go. So I'm being careful not to get any air bubbles. And I do not have any air bubbles, so I am going to use the scoop method to put the cap back on the needle. And I am going to ask another nurse to go ahead and verify that this is 20 units. So will you go ahead and verify that this is 20 units? Okay, and then I'm going to put my label on it. And then I'm going to set that to the side. So the next drug that I'm going to prepare, I'm first going to see that I have the right patient, Marge Simpson. I'm going to look at her allergies. She's allergic to penicillin and sulfa. Again, it is 3 p.m. and the last time she has had her on Dancitron was at 9 a.m. So it has been 6 hours. She's to get this in 4 hours when she is nauseous. So it is time for this drug. I'm going to make sure that I have the right drug on Dancitron and compare the barcode to my MAR. I can see that she is to get 4 milligrams intramuscularly. So this is a 2 milligram per milliliter. So she will get 2 milliliters intramuscularly. Again, I do have gloves on, so I will take this cap off and wipe it with an alcohol wipe for 15 seconds, and then I will let it dry. So I'm going to use a 5 milliliter syringe. My first choice was the 3 milliliter syringe, but unfortunately the numbers have rubbed off, so I'm going to use my 5 mil instead. So I'm going to open it, making sure not to touch the end. And I'm also going to use a blunt needle to draw up the medication. Okay. So she needs 2 milliliters. I'm going to insert the needle into the vial. And drop 2 milliliters. I'm going to tap out those air bubbles. Sorry. And then I'm going to set that to the side and use the scoop method to cap the blunt needle. So I have 2 milliliters. And then I'm going to add my label to the syringe and take this blunt needle off and put it in the sharps container. Then I'm going to get my 23 gauge needle or a 21 gauge. And I'm going to open it and put the needle on because it is for an intramuscular injection. So now I have all of my medications prepped and I am going to go to the bedside to administer the medication, which is also where I am going to do my third check. Okay. So this is my patient, Marge Simpson. So hi, Mrs. Simpson. My name's Ariel. I'm here to administer some medications to you today. Will you tell me your name and date of birth? Okay, perfect. And I can see here that you have a sulfa and penicillin allergy. Do you have any allergies to any other medications? Okay, no, perfect. So I'm going to be giving you your acetaminophen, your insulin NPH, and your ondansetron, since I heard you are feeling nauseous. So the first medication that I'm going to give you, Mrs. Simpson, is your acetaminophen. So I have checked the right patient, I have checked allergies. I'm going to go ahead and double check the first medication, but first I would perform hand hygiene. And I'm going to also don some new gloves while I'm in the room. And so I'm checking that the barcode says acetaminophen, and I'm comparing it to my MAR. I can have the right drug. I can see that she needs a 325 milligram dose. Each tablet is 325 milligrams, so she will only receive one. And she is going to take this by mouth. It is 3:00 p.m. and she has not had this dose yet. She is to get it daily. So I'm going to open this. And making sure not to touch the medication, I'm going to put it in the med cup. I'm going to scan Mrs. Simpson's wristband. And then I'm going to scan the acetaminophen label. And then I am going to give Mrs. Simpson her med with some water. So here you go, Mrs. Simpson. This is your acetaminophen. Okay. Now, Mrs. Simpson, I am going to give you your insulin and pH. And so let's go ahead and again check your wristband. I'm going to scan it again. I'm acknowledging her allergies again to sulfa and penicillin. I'm not administering either of those today. It is 3 p.m. and Mrs. Simpson, you have not yet had your insulin. So it is to be given to you daily, and I'm going to give this med subcutaneously. So you are to receive 20 units subcutaneously, and I can see that I have drawn up 20 units. I'm going to clean the injection site, and an appropriate injection site for this would be the abdomen, and I am making sure to stay 2 inches away from the umbilicus. And when I was cleaning the injection site, I'm cleaning from the center outwards, and then I would also leave the alcohol wipe to kind of point me to where I am going to administer the med. So I am going to pinch the skin up. So I'll take this cap off. And I'm going to pinch the skin up and enter the needle at a 90 degree into the pinched up skin fold. Then I'm going to administer the medication at a steady state and take the needle out, engage the safety device, and then I'm going to place it into the sharps container. But first I am going to scan it. Then place it into the sharps container. I would actually scan this before administering it to Mrs. Simpson, and then I would administer and then place it into the sharps container. So I am going to document that you were given your insulin and pH at 3:00. And after giving the acetaminophen, I would document that I gave it to her at 3:00. Okay, Mrs. Simpson, one more time to scan that ID, that wristband. I can see that I have Marge Simpson. I can see that her allergies are sulfa and penicillin. It is 3 p.m. and the last time she's had this next medication was 6 hours ago at 9 a.m. It is to be given every 4 hours with nausea. I am comparing the drug I have on the barcode to the one on my MAR on ondansetron. I have the right drug. I have 4 milligrams, which is 2 milliliters. It is going to be given to you intramuscularly, Mrs. Simpson. And I'm going to scan it before I administer it. So I would clean the injection site with an alcohol wipe, moving from the center out. And appropriate injection sites for a intramuscular injection would be the deltoid. So by finding that, I would locate the acromion process, and then I would go about 2 to 3 inches below. So I would use 3 fingers on the acromion process and then insert it right under my 3rd finger. Another good landmark, which I would use for 2 milliliters, would be the ventral gluteal. So by locating that, I would use the palm of my hand and place it on the greater trochanter. And then I would use my index finger and put that on the anterior superior iliac spine. And then my middle finger would be pointing toward the iliac crest. And the middle of that triangle that I would have made would be my injection site. So I am going to hold the skin taut by spreading the skin between my thumb and index finger. And then I am going to take the cap off of the needle, hold it taut, and I'm going to inject this at a 90-degree angle. And then I'm going to administer the medication at a steady state. Then I'm going to remove the needle, engage the safety device, and place it in the sharps container. And then I am going to grab my pen and document that I gave this medication to Mrs. Simpson at 3 o'clock. I'm going to put my initials, put my name, and do my signature. And I have completed my MAR. And I'm going to leave the patient in a safe position with the sides of the bed up and with the call device in reach. And that's the end of my video.